Prynawn da, croeso, welcome to this Teams meeting today to talk about the Welsh Government's announcement of the NHS Pay Award, which came out late on Wednesday evening. I'm Helen Whyley, I'm the director here at RCN Wales. I'm kind of your chair for the evening. I've got some really great panel members with me, and we're looking forward to a full discussion with you all today following the announcement. So it's really my job to do intros and welcomes, and then I will hand over to my colleague Nicky to set the scene for us before we get into questions, etc. We're using a Teams meeting platform because it's a really interactive platform, which means that people can talk on camera, raise their hands, etc. But the challenge means that if you don't keep yourself on mute when other people are speaking, it's really easy to get feedback and distortion. So just remember, including you, Mr. Jones, who's not on mute at the moment, try and keep your mute button on if you're not speaking, just so we get a really good sound quality for others to hear, etc. Teams gives us a bit of etiquette as well, because it does have a hands up system, and I can see from my participants list the order in which the hands go up. So if you want to come in, ask a question, join in, just put your hand up and I'll be sure to get to you, and I can follow that order without any real problems. Obviously there's quite a few of us, and that's great, but that does mean that Teams can give us the ability to see each other and interact more. But as I say, it has got a few challenges, just to make sure that we use mute and we also use the hand raising process. Perfect. And as you can see, we can sometimes get announcements to people joining too, but you should be able to see a list of participants in your screen as well by clicking on the people button at the top. There's also a chat bar in today's meeting, a conversation bar. I'll try my best to keep up with that as well. And, you know, if people want to put something in the chat bar, they can also do that. And chairing the event, I'll go between sort of chat bar questions and hands up as well. We've got an hour for our time together this evening, and really grateful that you've come along on a Friday evening to what is a really important issue for RCN Wales members, those working in NHS Wales. So it's really good to see lots of you here today. So I am going to pass you over to my colleague Nicky Hughes, who's the Associate Director here at RCN Wales, and she's just going to do a little bit of scene setting for us as to how we've come about arriving at this discussion this evening. Thank you, Nicky.
Lovely, thank you, Helen. And as Helen said, I'm the Associate Director and I'm leading on pay, and I'm lead negotiator with Welsh Government. So I attend meetings with Welsh Government. I just wondered, before I give a bit of an overview, whether Jackie, you wanted to just introduce yourself.
Yeah, certainly. I'm Jackie Davies. I'm a steward in Wales. Some people may already know me. I'm also the Wales representative on the Trade Union Committee, and the Trade Union Committee, which sits under Council, has the lead for pay in the RCN.
Thank you. And Richard?
Good evening, everyone. I'm Richard Jones, and I'm chair of Cwmtaf Morgannwg RCN branch. I'm also chair of the RCN Wales Board, and I'm your elected council member for Wales. It's really nice to see everybody this evening.
Thank you, Richard. So I also still work for the NHS. I do bank. In fact, I'm doing a bank shift for out of hours tomorrow. So, you know, I've got a little bit of awareness of what's going on at the moment and how difficult things are. So you're probably well aware that we've been waiting for the government to announce the pay award for quite a few months now. So they came out on Wednesday and said that we had a 3% pay award for NHS staff, and that would be what we can call consolidated. So that will go into your pay year on year, and it will enable you to use your go towards your pension as well. So in some ways that's a positive to look at, and it will be backdated to April. We did ask, you may have seen, we did an open letter to the Minister, all our trade union colleagues in June, asking for an urgent and significant pay rise, and that it was backdated to December. Unfortunately, that's not going to happen. It's April that it will be backdated to. So, so obviously we know that members within the RCN, your ask was for 12.5%. So we know that this is nowhere near what our members, what you feel you deserve. So we're coming out to you to talk about this and to find out what we do next. So on the side, we are asking as joint unions to for the Minister to meet with us to see if there's any additionality that we can get in Wales. But it is looking, one, that she hasn't really replied to us yet with the meeting. And two, I'm not sure that there is any opportunity to look for additionality in Wales. So we now have to act together, really. We will be going into what we call a consultative ballot. So it's over to you as members to engage with us and tell us what you think. So we will be coming out to you in the next 3 to 4 weeks. There's obviously a little bit of procedure that we need to go through to get the consultative ballot over the line, to make sure that we've got the right people that we're communicating with. And so we'll be coming out to you by email in the next 3 to 4 weeks to ask you whether you think it is acceptable, the pay award that we've been given. Now, it is a pay award, not an offer. So we can't reject it because it's an actual award that's going to go in your pay packet. Probably they're saying in October because of payroll issues and that kind of thing. So it's not something that we can reject. But that's not to say that we can't have a voice and say it's not acceptable. And we are going to take action because we feel it's not acceptable. You know, particularly in light of safe staffing. We know, you know, we've been talking, although we've got the Safe Staffing Act in Wales, we know that we still have areas, we still have times where patients are in areas where it is maybe not as safe as it should be. So we need to really make a stand. And if we don't give nurses what they deserve, then lots of you are telling us that you're thinking of leaving. You know, we need to value the nursing staff we have to keep them in the profession, to make sure that you've got good terms and conditions, good working environments, and you've got work-life balance, etc. And we need to be able to recruit people, and pay is a part of that. It's not all of it, but pay is really, really important. So it's not just about us going out and saying we demand more money. It's actually about keeping our patients safe. And I think we have to keep grounded in that. That's a really important situation. So if people ask you, you know, why isn't 3% good enough? Well, it's because we have patients who are not safe at the moment. So what can you do? So obviously having your say within the consultative ballot is a real must, you know, because we as a trade union cannot act unless our members tell us what you want us to do. So we can't go, you know, take the government on. It's our members that need to tell us what they want. So you are really, really important in this. So the first really important thing you can do is to go on My RCN and make sure that your details are up to date. In this first step of consultative ballot, we need to email you. So we need to be able to ensure that we can email you with an address that works. Sometimes it goes to spam, we know that, but we need an email. So that's one of the really important things that you can do. Hopefully tonight, maybe if you've got 2 minutes, or over the weekend. We've got a website, a Fair Pay for Nursing website, which Andrea's kindly put the link in the chat. And that tells you all about what's going on. We also have got videos, podcasts, information out there for you to have a look at, so that you're up to date with what we're doing. There's also posters. You can order car stickers, you can order badges as a member, you can order up to 25 and then go on tomorrow and order more. So please go in if you've got a minute and order some stuff. And I appreciate everybody's really, really busy. And I know everybody's really busy and everybody's exhausted, but even if you could just update your details and have a chat with your peers and your colleagues over a cup of coffee and your friends, family and neighbours to see why we need a decent pay rise, then, you know, that if that's all you can do, you've absolutely nailed it. You've done all you can. But as I say, there is more information on the website. And obviously get involved, you know, maybe have a work meeting in your workplace. If you've got a team meeting, see if your manager would mind you mentioning it. So, you know, you can get involved as little as you want or as much as you want. So that's my one plea for today, is to update your details. What will happen after that is, and it will be done through an independent company, so it won't be RCN. It's a company called Civica. So if they contact you, it's not you know, a ruse. It is actually us trying to get you to have your say. But after the consultative ballot, we will have a look and see what our members have told us. If members are telling us that they feel it's acceptable, then obviously we're a member-led organisation and we will accept that that's the way our members feel, how you feel. If indeed you decide that it's not acceptable, then we will be coming back out to you to ask what the next steps are. And that could be about taking action such as a form of industrial action. That's way down the road, you know, that's our last resort. But just to put that seed in your head that we may come out and say, well, actually, if it's not acceptable, what can you do? What are you prepared to do to take this forward, going forward? So I think that's sort of a general overview of where we are, and I'm just really excited to hear any questions that come up and to have a really good debate about what you feel about it, how's it made you feel, what your family are saying about it, because that's really important, public opinion, and obviously ask us anything you want to. Thank you.
Thank you, Nicky. Really helpful to set the scene and just update everybody what's happened so far and what's likely to come. And I'm giving people a bit of an opportunity to start thinking about their questions or type in the chat box. But I'm just going to take that one that you were saying there about family, and I'm just going to ask Richard and then Jackie, who are also part of our question answering panel this evening. So it's Nicky, Jackie and Richard, if they want to share what their families have said to them about this 3% award. Ladies first, I think. Jackie, what does your family think about it?
100% behind us. Absolutely feel that it's unacceptable. I mean, my parents, my dad in particular, didn't want me going to work because obviously I covered shifts and I worked clinically, and you know, for the first time in my career I had to wear PPE such as face masks, etc. But also over the 36 years that I've been a nurse, they know how hard I've worked and how difficult it is and what the pressures are. They know that for 11 years I struggled because I never had a pay rise. Everything else went up, every other bill went up. So I think the people closest to us are the ones that actually can see the real lived impact. And they were shocked that it was just 3%. So I totally have the support of all my family. And I did a couple of bits yesterday, and the messages I had of my family were, it's just fantastic, really. It's the support you need to really start this fight.
Thank you, Jackie. Richard, have you had a chance to, you've got a couple of sisters, haven't you, that I'm sure will have a view. They've got a view on other things in your life, Richard. What were their thoughts when you talked to them about this?
It's interesting, really, because my sister that lives very locally is extremely supportive, as my neighbours who actually are around where I live, because they know that I'm a nurse, they know that I'm very active in the RCN, and they have been really very supportive during the pandemic. Interestingly, my sister who lives in England, in Brampton, she comes at it in a different tack, really, because she says there are other groups like teachers and police who are not getting a percentage pay rise. So then I had to explain to her about how we have not had the appropriate pay rises over the last 10 years. And once I've told her that, she is very much on board. So for me, it's about how we actually keep the local population on board with the reasons why we want our pay rise, why we need our pay rise, why it will benefit patients. And for me, it's about safe staffing, because you need the right people with the right skills to deliver the care. And if people can get jobs that pay more outside of the profession, then it's actually going to be the patients that are going to suffer in the long run. So for me, it's a twin-pronged effect, really. It's about how we support our nurses, but as importantly, as we support our patients.
Thank you, Richard. I don't know if anybody else on the call wants to just say how they felt about the award. Jane, I think I can see, yeah, Jane's got her hand up. Would you like to come in, Jane?
Thanks, Helen. Yeah, I've been surprised, really, because in the past, I mean, Jackie and quite a few here have been in nursing for quite some time. It's been very, I don't know, there's been a different atmosphere amongst, you know, people kind of saying to you, well, you should be lucky to get that kind of award. But this time I get a sense, talking to neighbours and friends and family, that they feel quite strongly about it at this moment. They see how nurses have, over the last 10 years, and it was very interesting, somebody I know that's not political at all said to me, I've seen how nurses and NHS staff, so it wasn't just nurses, have had to take a bit of a hit to support the country. And that was what was interesting for me, to support the country, and they're being hit again. And I thought that it was quite stark for me, that I think if they're thinking that, somebody who's not really very political, I think lots of people must be behind us on this.
Thank you, Jane. Anybody else want to just share their sort of feelings when they heard the announcement, which did come out quite late on Wednesday evening? It was in a written statement as well. You would have seen our interim General Secretary describe the announcement in Westminster as being shambolic, which I think is a fair description, given that it's been coming for up to 10 days and then suddenly comes out after a junior health minister has had the floor of the Commons in a written statement. Obviously we saw it in a written statement here in Wales as well, but our Senedd did go into recess last Friday, so in some ways we have to allow them that was their only availability to be able to make the announcement. I can't see any more hands up for a moment, so since I've got the mic and I'm in the chair, I can ask a question. So Nicky, explain a little bit more for people that might listen to this Q&A later on that maybe haven't been active in the RCN. What exactly is a consultative ballot, and which members of the RCN can expect to be involved in this?
Lovely, thank you, Helen. Yes, so a consultative ballot is about asking your views. It's not about asking you to do anything, it's just about asking your views. And this is the first step in a much longer process. So that's what it is. And we will be coming out to anybody who works in the NHS and has an agenda for change terms and conditions. So so that'll be bank staff, that'll be anybody with a substantive contract within the NHS. Obviously people like Public Health Wales, they've got some staff that work clinically. So anybody who's got NHS within their job title and they're on agenda for change terms and conditions. At this point, students wouldn't, because if they're under the banner of the university, then students wouldn't come into this because they're not employed by the NHS under agenda for change terms and conditions. However, if you are a student who works bank, you are able to ring RCND and tell them that you've got a second job and you are able to then put that you're in the NHS. So you would then be okay to be part of the consultative ballot. And we know there are some students who are doing like an Open University course, and they've sort of still got a substantive Band 3 role, even though they're doing their training. So again, as long as they've got terms and conditions that are agenda for change, then you can be involved. And obviously, if you don't receive the email, and obviously we'll be doing a bit of a countdown to the ballot coming out. If you don't get an email and you think you should be involved, then just contact us and we can work that through with you, and we can make sure that you're involved. The consultative ballot will probably go out, we're waiting for our elected members in the Trade Union Committee to make an absolute decision on this, but it is likely that the ballot will go probably from around the 11th and 12th of August for 28 days till the beginning of September. So you have got time to, if you feel that you should have been involved and you're not, then by all means contact us. It might be after that we have to go to what we call an indicative ballot, and that's about asking if you are prepared to undertake industrial action. And that's just for us to get an idea of how many people would actually want to take action, because it's a very big legal process, and to be able to take industrial action, we have to go then to a statutory ballot, which will be a paper ballot coming through your door. And for that, we need to do any form of action, and we would ask you what kind of action you would want to do, whether it's action short of strike, working to rule, or whether it's strike action. Then we would need 50% of our members in Wales to put their vote in. So that's about 9,000 people. And to get anything over the line, whatever way it goes, so if we had a simple majority of 51% of those 50%, of those 9,000 people, 51% would have to say, yes, we want to go on to do whatever industrial action you choose. So we do have to get a really big threshold to get us over the line legally. So the consultative is just asking your views. The indicative is starting to ask, well, what are you prepared to do? And then the next one is absolutely what action will you take? So it's really important your details are up to date.
Thank you, Nicky. That's really helpful to just get that clarification. Helen Williams, would you like to come in or ask a question?
Yeah, I just want to confirm that the consultative and indicative ballots will be online and not a formal paper exercise.
Do you want to answer that one, Nicky?
Yeah, absolutely good question. Yeah, the first two would be online, which is why it's really important that we know your email address. And then the last one, if we go to there, would be a postal vote. So you would have to, put your tick in it and send it back. But again, that is really, really important, because if we don't get that back and we don't get the 50%, then we can't start organising anything to try and get us over that line. So that's really important. Thank you, Helen.
Thank you. Yeah, good question. I can see Richard has got his hand up. Would you like to come in, Richard?
Yeah. Yes, thanks very much. I just want to tell members that we have got very good governance arrangements in RCN Wales. We have set up, there's an operational group that's looking at pay, which Nicky leads on, and she's really working extremely hard on that. But we've also set up a subgroup of RCN Wales for pay and scrutiny, which has been formed as a subgroup of the board. And the people that are on that are board members. There's Nicola Milligan, the vice chair of the board. There's Jackie. There's Reese, who I can see is on the call as well. There is Billy as the lead steward is on that group. There is Denise Llewellyn as the PNC member. And to be honest, we have actually got membership of that group who are members of all the branches across Wales. So there's a really good mix of members on that group. And in fact, we have got a meeting on Wednesday coming up. So we have got good governance taking us right through the process. And I just thought you needed to be aware of that. Thank you.
Thank you, Richard. Whilst I'm giving you all time for further questions or to put your hand up, I had one more question that I thought again would be helpful if you would answer for members, particularly people that might look in at this, after we've finished completing it. So can you tell me whether or not the RCN will give members a steer in this consultative ballot? So can members expect to be just given a ballot, or is the RCN likely to give them some advice as to whether which way they think they should consider the award that's been made? Jackie, I know you're on the trade union committee, so I wondered if you might want to answer this one first.
Yeah, certainly. Thank you, Helen. The trade union committee are obviously going to meet and discuss and agree timings, the consultative ballot, the way forward, etc. And that will form part of the discussion, and we need to discuss that point and agree it formally. That'll be a governance issue. What I will say is that in Scotland, we actually suggested to members that they should reject the offer in Scotland. So far the premise from the trade union committee has been to advise members to reject, but that was an offer. There's a subtle difference here. That was an offer. This is a pay award. So like I said, the trade union committee have to discuss this, but our stance so far has been our members told us they wanted 12.5%. That was a comprehensive survey that our members responded to. And the feedback we've had so far from everybody is that, that's what they want. 3% is unacceptable. So, we can't kind of say, right, this is what we want in the RCN, but oh yeah, by the way, 3% is good enough. So we will discuss that formally in the trade union committee, but it's an award. We're having it anyway, but we can form an opinion, certainly.
Thank you, Jackie. It's helpful to hear that point of clarification, because I think it's something that members will be wanting to know as the consultative ballots come out. Helen, do you want to come in, Helen Williams?
Yeah, what I want to know is Scotland have gone their own way because of circumstances. You've got England, you've got Wales, you've got Northern Ireland. We go out to ballot. England vote to accept, Wales vote to continue with industrial action. What happens? Is it going to be England and Wales, and it doesn't matter which way the members in Wales vote because the members in England have voted this way, or vice versa? Or is it a collective thing? It's not going to be to the devolved administrations then, shall I say?
Yeah, really good question, Helen, because devolution's been around since 1999, hasn't it? But that is a very good question, and thank you very much for asking that, because again, I think that's one that members listening back to this will want to know the answer to. Jackie's nodding her head quite a lot there, so I think she wants to go first with answering this. But if there's anything that you want Nicky or Richard to say, Jackie, as well, just let me know and I'll throw it to them too.
Yeah, great, thanks. I always rely on Nicky to correct me if I go wrong. So please step in, Nicky, if I go wrong. But this will be to all members in the UK. Scotland is slightly different because they have kind of greater powers in terms of their devolution as well. But ultimately, you're absolutely right. What's the point in it being a little vote for England, a little vote for Wales? A little vote in Northern Ireland? We have one RCN, so we would look to get members' views on, the offer. And bear in mind that our members in Scotland actually voted to reject that offer. So they so that's the award in Scotland, if you like, has now been imposed on our members. So they are kind of in the same situation as us. But that's what we'll be doing. It'll be all the UK. Am I right, Nicky?
Yeah, I mean, we where possible, we want to. Now we know that the pay award is the same. Where possible, we would want to have a greater voice and join our colleagues in England. As you may know, Northern Ireland haven't even had an announcement yet, and they don't seem to have one coming soon. However, my understanding is if England members say that it's acceptable and they're happy to accept it, but Wales members say that they don't, then we will listen to our members. We will go through Trade Union Committee, and we as Wales members would take action if that's what people want to do. So it would be better, obviously, it would be better to do it all UK for RCN, but it would be even better if we can get our other union colleagues to get on board and work with us and take action as well. So, but obviously I don't know where they're at with that. That's their business, not ours. But the greater voice we have, the better in taking this forward. But certainly we would go to Trade Union Committee, but we would and our RCN Wales Board, but I'm sure that it would be, if our Wales members want to take action, then we will do that in Wales.
Thank you.
I agree, Nicky. Yeah.
Thank you. I think what we're hearing there is strength across the UK, because England and Wales have got an offer, but remembering that we've got two different governments, and the awards, I shouldn't say the word offer, I do beg your pardon, the awards have come from those two different governments. So it will be for members in Wales to say what they want RCN Wales to do with the Welsh Government, as it will be for NHS England RCN members to talk about what they think should happen in terms of the Westminster Award. So a little bit complicated, but isn't devolution always complicated? But you're also hearing that really powerful UK RCN approach where best we can, given obviously Scotland has got a slightly different position again. Helen's got her hand up again, but Reese has asked something in the chat box, which is another really good question and also brings in an aspect of funding. So I just want to go to Reese's question, and Reese is saying, are we in a position to advise the UK government that not only do we reject the 3% pay rise, but also that the money is not to be taken out of existing NHS budgets? And he goes on to comment that the service is already stretched, and he's afraid that this would lead to cuts in services, which would only further compromise patient safety and treatment. So there's two things in that one, really. He's asking, are we in a position to tell the UK government that we reject the 3% pay award? And are we also in a position to make more argument around the fact that we think it should be new money and not from existing budget? So I'll go to Nicky first for that one, because I know that's a debate that the staff have been having internally, and then I'll come to Richard and Jackie for any further comments.
Thank you. So we can't reject the pay rise as such because it's not an offer. So it's not something we can accept or reject. It's going to be in pay packets, whatever we say. So because it's an award, it is what it is, and we just have to accept that's going to happen. But we can have our say, and we can take action to show the government that we're not happy with this. Now, the funding around it at the moment is very sketchy, and when we met with Welsh Government, they hadn't had absolute confirmation whether they were getting some of the money, all of the money, or none of the money. So we're still in that position today, because obviously it's quite early on, that we just don't know. When we lobbied both the UK government and Welsh Government, and when we put our evidence into the pay review body, we were very, very clear in our ask that it should be a fully funded pay rise and shouldn't come out of the health budget. Unfortunately, it seems that the UK government may not agree with that, and it does seem that it might come out of the health budget. But if Eluned Morgan will speak to us, this is one of the issues that us as joint unions would very much take issue with her on this, because, as you say, we've seen it before where we've had run rates that have taken out numbers of vacancies to make the money to top up the pay rise, and we can't afford that to happen. That is just not acceptable, and we have to shout about this, and we will be.
Nicky, can I come in there as well?
Definitely, Richard.
Sorry, Helen.
I was just going to say, after you, I'll come to Jackie. So Jackie's ready as well.
Yeah, my understanding that Eluned Morgan, on behalf of the Welsh Government, accepted the recommendations of the review body in full. There was, in the announcement, they didn't say that they couldn't afford to pay the 3%. So there was no query, was there, with regard to Eluned Morgan on how the award is going to be paid?
Yeah, they will pay it, they will honour it. And in fact, to be fair to her, she said if England had had more, she would have honoured that as well. But we're at the 3%. But what we are being told is that it's unlikely that that is going to come, that it's all going to come from the centre. So Welsh Government will have to look at the health budget that they've got, and they will look at where they can, as you say, rob Peter to pay Paul. So they will have to look at whatever budget they've got, whatever services, and take that money out of the health budget. It's likely, that's what we're hearing.
Okay, thanks.
Jackie, did you want to come in as well on the funding issue?
Yeah, I just want to say I totally agree with what his sentiment in the comment, in that it's completely unacceptable that it should come out of the health budget. As Nicky has said, is something that all the trade unions collectively would criticise and take issue with. I've certainly seen a couple of things, some of the national newspapers and stuff in the media where this is an issue that is gathering a bit of momentum as well. But it does seem unacceptable. As the services are stretched anyway. We're looking at, paring back services. So for the money to come out of the health budget as it currently exists just is unacceptable. That's all I wanted to add.
Thank you, Jackie. In the chat box, I just put the link to the actual pay review body published report for this year. So those of you that are interested, please spend your homework time reading the report, because it has a number of things that are quite interesting. And I'll come to one thing in a minute that I'll ask you as a question if nobody else got their hands up. But obviously in the RCN, in terms of our next steps with the minister and with the joint unions, etc., we've started looking at the report because it's important we put evidence in this time from Wales. That's the first time that we'd actually done that, and obviously the Welsh Government put things in. But in terms of the argument around funding, which I think is really key, because for us, this is what Richard was saying about, this is about patient safety and quality of care, and we'll be doing some work on ensuring where we think the government can switch money from spend it doesn't need to make into substantive salary rises. And particularly on page 108 of the report is the agency spend for Agenda for Change staff groups, all of them, not just nursing, and it goes from 2014 to a forecast in 2021. In 2014 it shows the nursing graph, because it's got nursing in one graph and others in another, and in 2014 we spent I'm not quite sure, I think it reads like it's £30 million on agency, and in 2021 we're projected to spend £90 million on agency for nursing. So we'll be doing a bit of work just looking at the PRB evidence itself, because it's taken so many things, so that we can make really strong arguments, because this is really important to our members. And Reece, you're absolutely right to put it in that as a question. We will not tolerate the reduction in services to patients, or the eroding of safety, etc., to fund this pay rise. We're absolutely clear about that, when we can see a number of places where the Welsh Government needs to get its act together, quite honestly, and move money that's going from the public purse into things like agency at such an alarming rate, when you think about how much registered nursing substantive posts that would fund. And I know from my own volunteering in the vaccine centre, I stand there as a bank nurse on band 5, midpoint band 5, and the colleague standing next to me is from an agency, and they quite honestly say to me, I wouldn't do it for the money that the bank nurse is paid. So there's some issues that we need to make sure we argue on behalf of our members as we go forwards now into whatever action we need to take on the back of this pay award. And it does bring me to another question. Sorry, Richard, did you want to come in?
I was just going to come back in on the funding issue, really, because like you, I have read the report as well, and it actually says that in Wales to fund the 3%, and that's across all groups, it needs 111 million. Well, if you say the projection is 90 million just for agency staff, I mean, that can go a long way to actually fund it. Thank you.
Yes, definitely, Richard. And one of the other things the PRB start to make comments on is the lack of progression of nurses in Band 5. So again, they're making reference across the UK, but it's as true in Wales, and it's a topic that the Trade Union Committee debate often in terms of pay progression, and as do the UK Stewards Committee as well, I believe. And PRB is making a bit of a question, really. It's almost saying, has Agenda for Change had its time for nursing, or is it doing nursing the justice that it requires? So I did want to come to my 3 panel members and just ask them what their thoughts are about Agenda for Change and nursing, remembering that, of course, Agenda for Change came in 2004, so some 16 years ago now, 17 years ago, since it was introduced. So I don't mind who I come to first. I'm kind of looking at you all for signs of I want to go next, but perhaps I'll go to Nicky first, if I may. So just what your thoughts are about Agenda for Change and nursing, and what you think the future might hold.
Yeah, I mean, I'm not sure whether Agenda for Change will have a part to play moving forward in terms of looking at some of the new roles that should be created, such as consultant nurse roles, maybe. It doesn't give people the ability to move forward. And in fact, I was telling Jackie, I was talking to one of the workforce directors today, and we did wonder, because the increments there's only a few now, is it pushing people to progress up the ladder quickly and maybe not getting the experience they need to be able to undertake the roles they're doing? So I think definitely, if nothing else, Agenda for Change needs to be reviewed, and we need to be looking at whether it is fit for purpose moving forward. Having said that, I say that with a bit of trepidation, because I remember it coming in, and I remember the hard work it was going in, but we have to make sure that our pay structure is fit for purpose, and we have to make sure that it's flexible for the future to enable us to develop more roles and treat people equally and fairly for the jobs that they do.
Thank you, Nicky. Jackie, you seem to be in agreement with some of what Nicky was saying. Have you got any thoughts on that, or anything that's coming out of the Trade Union Committee? I'm sure you're still debating this issue.
Yeah, it is actually a work stream for the Trade Union Committee, and there are lots of strong voices that Agenda for Change, in particular with nursing, has had its day, because the ask of the job, the clinical skills, have changed enormously from when Agenda for Change was first created. So does it really capture, in terms of the levels, the process is complicated, everybody will know, does it really capture what nursing does? My personal view as a job evaluation lead is I don't think it does at all. What we do have to remember, which is really complicated, is that obviously Agenda for Change came in and it was very much around equal pay for equal work as well. So it ain't going to be as simple as moving nursing out of that overnight, because NHS as a body will need to consider fair pay claims. It's just a little bit of a minefield. My personal view is that it doesn't truly reflect the role, the responsibility of nursing, and it doesn't give. They should be band 6s according to Agenda for Change, in terms of if you consider the additional responsibilities nurses now have.
Thank you. Did you want to say anything on that topic, Richard? I've got one more really good question in the chat bar, but I can come to that in a second.
Yeah, I mean, I'm agreeing with both Nicky and Jackie. The thing with Jackie is that we as council will be very interested to see the outcome of that work stream, because I think that moving forward, we need our profession to have the terms and conditions of service that are fit for the future. And for us, I think it's important that work is done at pace, to be perfectly honest. Thank you very much.
Thank you, Richard. So a bit of a watch this space, it sounds like, because Trade Union Committee have already got their sights on this. And obviously we start to do a bit more analysis of the actual report. So Helen's put another good question in the chat bar, and she's asking, is the RCN going to follow other public sector staff representation groups and declare that they have no confidence in the pay review body? Oh, that's a good one, Helen. I do like that one. Again, I think it's quite a complicated one, and I'll come to Jackie first on this one, if I may, and then obviously I can bring in Richard and Nicky as well.
Unmute, so turn the fan off, sorry. I've been following that quite closely today, and lots of comments, you know, from quite well-respected people as well, asking that question. I just said the other trade unions are asking that question. Our interim chief executive of the RCN, Pat Cullen, yesterday asked that question when we had the UK webinar. That has definitely got to be on our agenda for discussion. I think it was asked yesterday, are they truly independent? Because when you look at the evidence, particularly the evidence submitted by the RCN, which was comprehensive, it was credible evidence, how they could possibly then come with a recommendation that they made. And also, if you look at the actual peer review body report, it's always kind of contradicting itself, as Helen's already said about the agency costs. It's like there's stuff in there they think, oh, this is really serious, but they had no regard for it. So I personally think that, and this is my personal opinion, the peer review body has had its day. But I think the RCN as an organisation, it's not for me to answer on behalf of the RCN today, but I say we'll definitely be having that discussion.
Thank you. Richard or Nicky, do you want to come in on that point?
No, it's just that I agree that with Jackie that we really need to be having that detailed discussion, and then moving forward, coming to a conclusion of what we want to do.
Thank you. Nicky, did you want to say anything on the independence or not of the pay review body and our confidence in it?
Yeah, I think we are all questioning the pay review body and whether they are truly independent, particularly as the doctors' unions, the doctors' pay review body, because they've got a separate one, actually came out with the same. So are they truly independent? But I suppose for me, we would have to be careful about what we ask for, because if we think of where we are with government at the moment, if we took pay review body out and we didn't have any independent process at all, then I'm not sure they would come to the table to negotiate. I think they just say 0% or 0.5% or something, because at least the pay review body having an independent somebody to look at things can hold the government to account. Whereas I think if we don't have anything at all, that just allows the government to do whatever they want, and that's going to be as a detriment to us.
Thank you. Helen, you've got your hand up. I didn't know if you wanted to come back on that point because it was your question.
Yeah, I just wanted to say my experience of the pay review body was in the last pay round when they came to Howell that, and we were invited as staff side organisations to meet with them. And we had to explain that, no, that only happens in England. It doesn't happen in Wales. And I thought, well, you know, if you're the independent pay review body for the UK, then you should know what's going on in the UK, not just what's going on in England. And I lost confidence in them then.
Jackie, I think you wanted to come back in on this issue.
Yeah, I just wanted to follow up on Nicky's. I totally accept what Nicky's saying. It's kind of like, you know, would they even come to the table? But I think in this particular instance, the government have almost used and abused the peer review body. They sat on that report for a month. The peer review body process in itself took months and months of time. So is that process just biding time, whereas we could just get straight to the nitty-gritty? Because what we do know as well is that the government doesn't have to accept what the peer review body does, and may well just do what they're going to do anyway, and then we are right. We can take action in terms of what we want to do.
Thank you. Yeah, another really good topic and another really good question. I'm really mindful of time. I know I've only got a few minutes left, but Reese has put a really good question in the chat bar as well. So I want to try and cover it, even if that means that we do a very quick thank you at the end. So Reese is saying, if strike action is voted for, and I think we all understand from what Nicky was saying, that's quite a long way away in the process, but I think he's posing that if it was voted for, what sort of outcomes do you panel think that members could expect? A government U-turn, i.e. more money on the table or a bigger award made, or a standoff where we could lose support from the public? So another really good question. Anybody want to go first on this one? Richard, I haven't asked you to go first for a little while. Do you want to go first on this one?
Yeah, thank you, Reese. That's really helpful question there. I have to say, I mean, we're stargazing a little bit here, to be perfectly honest. For me, I think what is important is the fact that we do not accept that 3% is sufficient to support our patients going forward. And for me, we've got a really good industrial action handbook now, where we can actually be going through quite different levels of industrial action. It doesn't necessarily have to be strike action. It could be limited action as well. I mean, they did this in Northern Ireland, and they, with great effect in Northern Ireland, but they took the general public with them, and they actually took some of the managers with them as well. So it's the way that you actually approach the industrial action and the careful way in which you implement it. So I think that, I don't know what the outcome would be, but I think the process in which we do it is important.
Thank you, Richard. Nicky, did you want to say anything on that one? And then I can see Sarah's got her hand up, so I'll come to Sarah. Oh, Jackie has too. So Nicky, I'm going to keep you to a minute.
Yeah, no, nothing from me. Richard covered what I was going to say.
Super. Jackie, did you want to comment on that particular issue?
Yeah, and I would just say that each of those questions, the answer is it's really up to the members. So if the consultative ballot people overwhelmingly say, no way are we happy with this, indicative ballot, what action would you be happy to take? And people are saying, I want to strike. And then we do the proper statutory ballot, obviously with a very formal process. If we have the majority of our members, a high turnout who say, who turn out first of all, and then the majority of those people, and a strong majority, say we want to take industrial action, that's going to make governments sit up and think. So it really is absolutely in the hands of the members what response we get from the governments. If we have a poor turnout, well, if we have a poor turnout or we have a poor response, then they're just going to say, well, clearly they're not that interested. Clearly they're not that upset.
Which reiterates Nicky's point earlier about whatever your view is, have your view. Sarah, you've got your hand up. Can I bring Sarah in? Thank you.
Hiya, thanks for the meeting this evening. linking on to that now, I'm just thinking about how do we get staff motivated? There's only 16 people on this meeting tonight. I'm a bit disappointed, I have to be honest.
Thank you, Sarah. Time is marching on in terms of responses. So, Nicky, do you want to go first? Because I know that you'll take a perspective of things that you've been planning as with your employment relations team.
Absolutely. So we've got a number of things planned over the coming weeks. So we're doing workplace events. They are virtual, unfortunately, because of the world we're living in. So you will have some information about when we are coming to you so that people can join us. Obviously, the more our members, you know, people don't want to hear from the RCN necessarily. They want to hear from their peers, from their colleagues. What do you think? What are you doing? So again, it's back to try and get people to come to these meetings, have their say. The branches are holding meetings. Try and come along to those, you know, have those conversations in the coffee room, in the corridor, you know, get some of that material to just hand out to people, because we can't be in the workplaces so much now, whereas you can. So we're thinking about how we can do some events outside the hospitals, maybe, whether that's branches, whether that's reps, just to again just give out lots of information. And we also are going to get what we call an ad van, one of these vans that's got digital images, and that'll be driving around not only to across Wales, all across Wales, not only to highlight public issues to the public, but also to get members to vote. And I suppose we can't do this on our own. We have to have you members out there being active. As I say, if that's all you can do is have a chat with people over coffee, that's fine, but we just need to get people talking about this and get people agitated so that, you know, they actually put their stamp on that ballot paper. As Helen said, whatever your views, whether if you accept it, that's it. If people don't, then they march forward. But we need you, our members, to be really taking this forward. And we'll do everything we possibly can that we've been doing over the last 6 months, in that we've been having meetings, we have rep meetings, we've had pay Q&As with our members, we've put out videos, podcasts, information every single week. So and the other thing you can do as members is just on your phone, just talk for a moment or a minute on what this pay rise means to you, and is it what you deserve, and then we can upload that onto our website or put it through Twitter, Facebook. It's people will listen to you, they won't necessarily listen to us. So I can't say it more. We need members to really take this on.
Jackie, did you want to say anything? You know, you're our Wales rep on the Trade Union Committee. I'm sure the Trade Union Committee have talked about this a lot as well.
Yeah, absolutely. I mean, Nicky summed it up in the last sentence in particular. It's about our members on the wards. And, you know, I follow social media a lot, and there's certainly a couple within my organisation who have just become really active. They don't want to be reps, they don't want to be stewards, but pay is a huge issue for them. And that, you know, when you're in work, reminding people, talking about it, certainly the branches are going to be very active. Some of the reps will be very active as well, but obviously, you know, that, you know, we're limited in terms of numbers. So it really boils down to that footfall. We have a number of pay champions. We'll be getting a lot of communication, and it's having that tea room conversation. You're there in the tea room on your break. Well, I filled in my survey today as anybody else, and just sparking that memory, you know, trigger for people to take back. But you're absolutely right. It's all about getting people motivated to respond.
I can see we're going just past 9 o'clock, so I'm going to sort of bring us to a close. But I think the other point I would like to just say on that issue is think about what your colleagues are passionate about. And for me, every nurse I meet is passionate about patient care. Every nurse, without exception. So remember this pay rise is about patient care. So you start the conversation by saying, you know, are you passionate about patient care? Because if you are, it's a bit of a, you know, a line by a famous cosmetic company. We're worth it, and we're worth it because that's what matters for patients. So I really, really hope that people on the call today and people that listen back to this will think this doesn't belong to the RCN. This belongs to me as a member. And if I'm passionate about the care that my patients get, then I'm as passionate about how I'm valued in this society for the work that I do. And therefore, it's important that I talk about pay and I speak up for it. And I'm looking forward to standing next to members as they do that over the next few weeks and months. So absolutely, as all of our panel have said, whatever your view is, have your view. We want to hear from you.